According to the American Red Cross, every 2 seconds a person in the United States needs blood. What if this person was your mom, dad, brother, sister, or best friend, and the hospital ran out of the blood type that they need? Personally, I'm a frequent blood donor, and a few years ago my mother was going through lung cancer, and during her treatment she needed a blood transfusion. You should donate blood. Every year, 5 million Americans need a blood transfusion. The problem is that there is not enough blood in the United States. There is a very high shortage in blood. The reason for this is that there isn't enough people donating blood in the United States. And there is a wide variety of diseases and conditions that require a patient to get a blood transfusion. There is a simple solution to this problem, though. More people should start donating blood regularly. First, we will discuss the problem, which is there is a low blood supply in the United States. According to the American Red Cross, 30 million blood components are transfused to patients each year. And blood cannot be manufactured. It can only be transfused from donations from volunteers. There are many different types of blood that a person may need. There is A, B, AB, and O. And there's also the characteristic of it being positive or negative. O negative blood is the universal red blood cell type. And this means that anybody who needs red blood cells can use O blood. AB positive blood is the universal plasma donor, which means that any patient that needs plasma donated to them can use AB plasma. According to Mary Engel from the Seattle Times in 2007, the amount of blood transfusions that are needed each year has surpassed the amount of donations that are given each year. According to the American Red Cross in 2009, 90% of donors are occasional donors. 31% are first-time donors, and only 50% are loyal, regular blood donors. This percentage should increase in the United States. Now, we will discuss the reasons that there's a shortage in blood in the United States. The biggest reason is that there isn't a high enough number of blood donors in the United States. There are also many different types of diseases and conditions that make people need blood. One severe type of disease is cancer. Cancer patients, according to the American Cancer Society, there are 1 million new people diagnosed with cancer each year. Cancer patients frequently need a blood transfusion because the chemotherapy that they are getting as a treatment affects the bone marrow, which destroys the red blood cell and platelet-making cells of the body, meaning that those two components are low and they'll need a transfusion. There's also a condition that cancer patients normally get is anemia, or anemia from chronic illness. And this disease shows that there is a low red blood cell count, meaning they will need a transfusion. Another reason why people will need a blood transfusion is from car accidents. According to the American Red Cross, one single passenger in a car accident may need up to 100 pints of blood. And this would mean that there needs to be 100 people donating that type of blood because only one donor does 1 pint of blood. There are also a few different types of blood diseases. One is hemophilia. Hemophilia patients have a lack of platelets, meaning their body isn't able to clot the blood. So if a patient comes in and they had a cut or some other type of wound which caused bleeding, they are not able to clot that blood and they will lose a lot of blood, meaning they will need a blood transfusion to resupply their system with blood. Another type is sickle cell anemia. Sickle cell anemia patients have red blood cells that are shaped like crescent moons, so it is very hard for those red blood cells to travel through the capillaries into the heart, into the blood, into the brain, and other vital places of the body for survival. This disease affects about 80,000 people in the United States every year, and they frequently need a blood transfusion. Now, what could solve this problem? The answer is clear: more blood donors. If everyone that was eligible to donate blood did, the blood supply would be much higher. Donating blood could save up to 3 lives, with red blood cells, platelets, and plasma. Red blood cells are for oxygen, platelets are for clotting, and plasma is to transport nutrients and water throughout the body. Redemeyer from Transfusion Medicine in 2001 calculated that if a person starts donating blood at the age of 17 and donates every 56 days like you can until the age of 76, they will have donated 48 gallons of blood, potentially saving 1,000 lives. Donating blood is a safe and easy process. And according to the American Red Cross, the whole process takes about an hour, but the donating part only takes about 15 minutes. Although the world is faced with this huge problem of blood supply, there is an easy solution in making more people donate blood. In conclusion, there is a shortage of blood supply in the United States. The reason for this is that there is a wide variety of conditions and diseases that make people need a blood transfusion. But there is a simple solution: more blood donors. Therefore, you should donate blood. If you like making a difference in the world and saving lives, the easiest thing for you to do is find a blood bank, donate a little of your time and a little of your blood, and go save 3 lives.